Hospital. Dr. Strachan, and in your scrubs as well, look, a very Merry Christmas to you. And thanks for taking the time out of what I imagine is quite a busy day. Just give us an idea. What are the problems that you're experiencing, if any, on the front line at the moment?
Well, you're absolutely right. It is busy here in Milton Keynes, like it is in many hospitals across the country. It's busy with the normal stuff you might expect in winter. So today I'm anaesthetising patients later on for operations on their hips, broken hips, that sort of thing is carrying on as you might expect. There's lots of unwell patients with a raft of things, including coronavirus. It's busy here, and that's, of course, a bit compounded, the busyness, by staff absences through contracting COVID, which is happening as well.
Yeah, we'll talk about staff shortages in just a second, and obviously this is your individual experience, it's anecdotal, but if you kind of compare to where we were in terms of capacity, in terms of the patients that you were seeing roughly this time last year, how does it compare?
Well, there is much more in the way of non-COVID work going on than this time last year for whatever reason. But equally, we've still got some COVID patients coming in, not in the numbers they were this time last year, absolutely. We're braced to see if the new variant spreads rapidly and gives us more patients to look after. But at the moment, there is less in the way of COVID patients, but we're planning that there may be a sharp increase over the next coming weeks.
Yeah, I mean, you'll have seen the data in terms of Omicron from UKHSA, the React1 survey and all the rest of it. Does that make you feel you're heading into the Christmas period working on the front line of the NHS? This might seem slightly inappropriate. Does that make you feel any less apprehensive about what might be coming down the pipeline?
From my point of view, no. If you have severe COVID and you need intensive care, the sort of claims of it being more mild are irrelevant to that patient and to that medical team. Yes, it would be easier as a hospital for us to manage if there were less cases of severe illness. But for an individual patient or doctor dealing with it, it's still an absolutely wicked illness that causes significant unwellness in people. So less apprehensive on a big scale in terms of the problems that we saw last year, perhaps, but actually on an individual basis, it's still a very severe and dangerous illness.
Certainly is, certainly is. Oh, please, if you need to stop because one of your colleagues needs to drag you off, I don't know, for an operation or something, please do feel free. But we talked about staffing just a moment ago, and some estimates, I saw one from the BMA, between 32,000 and 140,000 people could be off work by Christmas Day within the health service. Where are you seeing the pressure points in terms of staff shortages yourselves?
So we are seeing staff absence going up here in Milton Keynes, and that's across the board really, because it doesn't particularly affect one group of staff more than others. I think we're vulnerable because we're already running hot in the NHS in terms of staffing numbers. There are vacancies, certainly in terms of anaesthetists, in consultant anaesthetists and anaesthetists in training. We need more of those. So we're already running a little hot, and then you add into that increasing demand and absences, then it does make it more tricky. You're stretched thin, and so you have to prioritise and work that bit harder just to try and get the best care for the patients that are here. So, it is a concern.
Doctor, I mean, how is the mood in and around the hospital at the moment amongst your colleagues? Like, I recognise an accent when I hear one. We both know just how important this time of year is to us, Christmas and, of course, Hogmanay as well. Yeah. But you are on the front line of the health service. You are dealing with some very, very sick people. You are seeing people, your colleagues, going off sick as well. And we don't quite know what Omicron is going to turn into. How is everyone feeling?
Well, I think, there is that apprehension and fear. We've been through this several times now in terms of waves of the pandemic. So there's less unknown in terms of the disease. The treatments we've got now are better. So people from that side of things are perhaps reassured, but we know it can cause such severe illness and death in young people, that relatively young people, that still makes people worried. You combine that with, that lack of the ability to live normal life and perhaps go out and party for New Year's Eve and those sorts of things, which everybody is doing the right thing and limiting their mixing with other people at this time in order to protect the NHS and our colleagues, really.
And I suspect I might know the answer to this question. What are you doing for Christmas yourself? Are the scrubs off or are the scrubs on?
No, I'm very lucky this year. So tomorrow
Okay.
I'm not working. I'm going to be spending Christmas Day with my wife and children, and hopefully we'll see the in-laws as well. So we're getting to see family, which is great. But there will be plenty of my colleagues here providing emergency care for people that need it. There'll be operations going on for those that need it as well. And the intensive care is busy. Will be staffed by the people that are here. So no, I'm very lucky this year. I'm getting to spend it with my family.
Well, from everyone here at Sky News, from everyone watching, thank you so much for what you're doing, and have a very lovely Christmas when it comes, Dr. Strachan. Thanks for being with us.
Thanks very much.